Good afternoon. Thank you all for joining us for the Government of Newfoundland and Labrador's COVID-19 update for today, Wednesday, March 24th. I'll turn things over to Dr. Fitzgerald to give her latest update on today's numbers.
Thank you, Premier. Good afternoon, everyone, and thanks for joining us. Since the media advisory yesterday, we have one new case of COVID-19 in our province in the Eastern Health Region. The individual is between 60 and 69 years of age, and the case is still under investigation. The total number of cases in our province is now 1,015, and there are 3 active cases, and 1 person is in hospital due to COVID-19. A total of 122,704 people have been tested to date. We continually assess our measures of epidemic control, and thankfully we have been consistently trending in the right direction in recent weeks. 6 weeks ago, during the week of February 10th to 16th, we had reported 260 new cases. We are down to 1 case over the last week and now 1 case reported today. The 7-day moving average has gone from 40 cases in mid-February to less than 1 case as of today. And we've had 15 hospitalizations that resulted in 7 ICU admissions and unfortunately 2 deaths during the recent outbreak. The number of admissions has slowed, and there has been only 1 admission to hospital since the end of February. The daily percent positivity in our lab testing is now at 0.3%, down from a high of 4.8% on February 10th, and our 7-day average is 0.14%. Since we began reopening, we have not seen evidence of increased viral transmission stemming from either the outbreak or new sources. And in addition, we have not had any new non-epilink cases related to the outbreak in at least 28 days, which is 2 incubation periods for the virus. I'm therefore pleased to announce that the whole province will move to Alert Level 2, effective 12:01 a.m. Saturday, March 27th. This time around, we will all need to do things a little differently. I think it's safe to say we are all startled by this outbreak and how rapidly it escalated, and we don't want to be taken by surprise again. We must be mindful that the epidemiology outside our province shows that case counts continue to rise and variants of concern are becoming the dominant strain in many jurisdictions. So we will almost certainly see another variant case in the province. And these are a game changer. They're not the same as the original COVID-19 strain, and they spread easier and faster. And in many cases, by the time someone tests positive, the virus has already spread to their contacts and onwards. So because of the increased risk from importation of the virus, particularly the variants of concern, we are making some modifications to our Level 2 guidance. We will continue to assess the epidemiology and risk level in the coming weeks to determine if adjustments can be made. We are cautiously increasing the maximum for formal gatherings to 50. This applies to events such as weddings, funerals, and faith-based services when held by an organization or a business. And if things continue to go well, we see sustained low numbers and no new non-epilink cases, particularly variants, we hope that we'll be able to raise this number in the coming weeks. The single most important thing that everyone can do right now is to keep your contacts low. In Level 2, we recommend a steady 20, which means a maximum of 20 close, consistent contacts for your household. This means that your household chooses up to 20 close friends and or family, and these are the individuals that you interact with in close settings, such as in your home or sharing a table at a restaurant. The difference between a contact and a close contact is not defined by your interpersonal relationship with them, but by how often you interact with them, the setting you interact with them in, and how close in proximity you interact with them, as well as how long in duration the close interaction is. So once again, it is defined by people, space, time, and place. Just because there are 20 people you can interact with, that doesn't mean that you should have a gathering with all 20 people. Remember that those in your steady 20 may have a different set of contacts from yours. You should not bring people together who are not one another's contacts. For this reason, informal gatherings are not really recommended at this time. If you are thinking of having a birthday celebration for your child, please try to keep it small. Your child's full class cohort are not really considered a part of your steady 20. Interactions in school are essential, and we want to reduce non-essential interactions. So if you have a birthday celebration, please limit it to your child's close friends or your family. If it's possible, choose outdoor events. If you hold a celebration at a business, please ensure that they have appropriate public health measures in place, including space for physical distancing and cleaning protocols. For businesses in level 2, gyms, fitness facilities, swimming pools, dance studios, yoga studios, tennis and squash facilities, and arenas can open with a maximum capacity of 50 people per room or rink surface, provided that physical distancing can be maintained. 50 will also be the maximum capacity for facilities such as bingo halls, performance spaces, and cinemas. Again, if all goes well, we will look at raising this maximum in the weeks ahead. Restaurants, bars, and lounges can open for in-person dining, reduced to 50% of normal capacity, as long as physical distancing can be maintained between patrons seated at adjacent tables. Buffets remain prohibited. Where possible, any employee that can work from home should continue to do so. And maintaining work from home policies is really one important way that the business community can help keep contacts low. I know that many people in our province, particularly our youth, will be happy to hear that sports teams and organized group activities such as dance, art, music, and performance groups can resume. Initially, teams will be permitted to offer individual athlete skill development and team practice or training sessions, which could include intra-squad competition, so that's within members of the same team. To return to inter-squad competition, we ask each provincial sport association or other sport provider, including private, recreational, and community-based sports providers, to submit a return to sport plan with Sport NL or the Department of Tourism, Culture, Arts, and Recreation. This plan should include competition that would fall within the regular competitive schedule. As an example, if a soccer league has always been regional in scope, regional competition may be permitted following review and approval of the return to sport plan. If the league has always been provincial in scope, it may be permitted following review and approval of the return to sport plan. The plan should also outline how they can return to games while helping to keep the number of close contacts as low as possible. And we are working with Tourism, Culture, Arts, and Recreation to develop a template which organizations can use as a guide for preparing the return to sport plans. Tournaments will not be allowed right now, but may be permitted later in Alert Level 2. Participants in any sport activity should arrive dressed for the activity and avoid change rooms if at all possible, and change rooms should only be used when necessary, and masks should be worn as much as possible. There should be no social activities associated with group or sports events, such as socializing in change rooms. Socializing should only be with those in your household steady 20. Evidence tells us that higher intensity activities in indoor settings carry a greater risk of viral spread. As the weather improves, we hope that many of these activities can move outdoors, where the risk is much lower. Effective Saturday, the special measures orders for personal care homes, long-term care homes, and assisted living facilities that came into force on March 13th will be repealed. With this order repealed, visitation within residential care will expand to a maximum of 6 designated visitors, allowing residents to reconnect with more loved ones. One thing we need to do differently in Level 2 is wearing our masks more. We should wear our mask anytime we are in indoor public spaces or interacting with people outside our close, consistent contacts. When you go to a movie, a church service, or a performance, you should keep your mask on the entire time, even when seated, and only remove it to eat or drink. If you are engaged in a low-intensity physical activity, you should keep your mask on if you are able to, and we ask that everyone use their own discretion in determining at what point it should be removed. The more time we have our mask on when we are around others, the better. I know that returning to Level 2 is welcome news, but we need to proceed with caution, and if the virus is once again to be introduced into our province and begins to circulate widely, we will likely need to lock down again. So the key to preventing another outbreak is for everyone to keep their contacts low. When we do this, the virus does not have the chance to spread as far and as fast. Our shipments of vaccine continue to be rapidly administered by regional health authorities, and over 53,000 doses have been provided to date. Today, we are expanding the pre-registration system to include Indigenous adults living in the province. This will help facilitate planning to administer vaccination for this priority group. As we anticipate a significant increase in vaccine supply in the weeks ahead, we are also seeking physicians and pharmacists who are interested in supporting the continued deployment of the provincial COVID-19 vaccination plan. So starting Friday, physicians and pharmacists will have the ability to identify if they would like to administer COVID-19 vaccinations and be immunized themselves. Providers can complete the COVID-19 immunization registration form in either Health E&L or MedAccess. As a recap, for those who may have just joined us, we have one new confirmed case in yesterday's media advisory, and the total number of cases in the province is at 1,015. We have a very delicate balance to achieve right now as we work to vaccinate as many people as possible while preventing another outbreak. It will take everyone's cooperation for us to be able to stay at level 2. So please keep your contacts low and practice all your trusted public health measures of hand washing, distancing, and wearing your mask when near others outside of your close contacts. Each day without COVID in our province is a gift. Now is the time to safely reconnect with one another and get back to the activities we enjoy. Let's appreciate every moment and hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. A good day indeed. I'm sure many of us are breathing a sigh of relief with today's news. This is great on many levels. Our province has successfully dealt with an outbreak of the variant. More people can return to their livelihoods and see their loved ones. More and more in the last few weeks, we've all been wondering and hoping about when we would get to see alert level 2 again. And here we are. Again, thanks to Dr. Fitzgerald and her team for guiding us through some rough waters. As we've seen firsthand, the restrictions, tough as they may be, work. As we open up, we all need to follow the rules, now more than ever. That's how we will stay in alert level 2. So enjoy this alert level 2, but do so responsibly. Masks on, social distance, follow all the public health guidelines. I hope you can safely enjoy these sunny days we're having and know that there are brighter days ahead as more and more vaccines come into the province. With that, I'll turn it over to Dr. Haggie for some brief remarks. Minister Haggie?
Thank you very much, Premier. Just open by apologising to the hard of hearing community for the lack of sign language interpreters today. That was unfortunate. Our agency has none available, sadly. One new case, 3 active. Good news to go with the good weather we're currently experiencing. As Dr. Fitzgerald says, we have administered now a total of 53,769 doses of vaccines of all kinds. The rollout of the vaccine continues to progress. We have, as we move into the back end of phase 1 and into opening up phase 2, started to use a pre-registration process. What this does is allow people to express interest in getting the vaccine and for at the back end to make sure they're eligible within that cohort. So they're over 70 or they're a home support worker or first responders. Those are the ones we've opened up very recently. As Dr. Fitzgerald has announced, we're now expanding this with another 3 categories: adults, Indigenous, off-reserve, the healthcare workers who were not vaccinated in phase 1, and she mentioned specifically pharmacists and physicians who now have the opportunity to also register to be able to administer the vaccine when we move into the mass vaccination stage as we go through the levels. The people who have registered, or pre-registered rather, and have not yet received their code and their URL, don't worry. We are going through them in the order in which the vaccine comes in, and you've not been forgotten. We will, when the vaccine is available and we know the promises are there, open up more clinics, and so you will then get a link and a passcode, and you'll be able to go and pick your own site and your own date and time. We haven't forgotten about you. It's a rolling process as we add ones onto the new end, as it were. The website will be updated with the new groups that are coming on for pre-registration, and within the the higher risk categories of phase 2, as we add more and announce more pre-registration, we will update the website there as well. As the vaccine arrives, the clinics are scheduled around that, and they're also varied to allow for some geographical distribution, bearing in mind our large landmass and surface area. So these will change from week to week and month to month. So that is one of the reasons why we have left it with the software, as it were, to allow you to choose on a given occasion. From the point of view of our planning, we're still on track to deliver 80,000 doses by the end of next week, by Easter. Every eligible person who wants a dose of the vaccine should be able to have had their first dose around Canada Day. And then we can go back and offer second doses as and when the vaccine continues to arrive. No one will be left behind. It is simply a question of following the rationing, as it were, that Canada has to manage, and that in turn we get our share. Again, the public health measures that Dr. Fitzgerald has emphasized and the Premier has emphasized have worked, and they will continue to work, and really will have to be a staple of everyday life for some time yet to come. So I'll close by encouraging everyone to hold fast to those public health principles, and hand it back to yourself, Premier.
Well, thank you, Minister. I'll now invite questions from the media.
Thank you, Premier. For the benefit of our speakers, there are 6 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have 1 final question. Our first questions are from Elizabeth Whitten with All Newfoundland Labrador. Please go ahead.
Thank you. Previously, Dr. Fitzgerald, you said we wouldn't skip these alert levels, that we'd have to descend through them. And now you've announced we're going from alert level 4 to 2. So why this change?
Thanks, Elizabeth. So I think, for us, we were looking at the numbers and just where we were and how well we have done. And with so many days in the last couple of weeks with no cases or 1 case, it just seemed like it was a really prolonging process that didn't need to be prolonged. And so, we've always said that if the evidence points us in a different direction, we will. So I'm very happy to have to take that back and make this call today.
Certainly all happy.
And to follow up on that, I'm curious, at what point in the last 2 weeks did you start thinking we're going to jump this level 3 to level 2?
I think probably over this weekend and at the beginning of this week, we really that sort of solidified for us at that point, yeah.
Thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. Premier Furey, last week you told me that the earliest we could rejoin the Atlantic bubble was around April 9th, and that was due to the 2-week system in which we were coming down in our alert levels. Now with us moving down to alert level 2, how does this impact our participation?
Well, if we can stay at alert level 2, and as we've said, things can change based on the epidemiology here, but also the epidemiology in the Atlantic provinces, then I think we're on track to hit that April 19th deadline for sure. But the concept of joining the rest of the Atlantic bubble will depend on alignment of the alignment of the Atlantic premiers and the chief medical officers of health. But this is a good news. This is a good sign, a good signal that certainly if we can keep the numbers where they are, if everyone continues to dig a little deeper and follow public health guidelines, that we're certainly on track for the middle of April.
Thank you. And Dr. Fitzgerald, in your preamble, you mentioned about the possibility of other variants eventually arriving here. From this outbreak, what did we learn from this outbreak that can help us now in preparing for future variants arriving here?
So we've learned a lot. We're still learning. And certainly I think we realized just, with regard to variants, how quickly they can spread. We all saw that curve that just shot up almost straight. That's not what we like to see. by any stretch. So I think, we've realized that these variants have changed the way that we look at this virus. And so, we've looked at testing and increasing testing in rotational workers, for example, and we have guidance that's been developed specifically when we know we're dealing with variants of concern. So I think, we certainly have learned a lot, and will certainly have a high degree of suspicion moving forward. We're going to be testing any travel-related samples or positive samples that we have for the variants. So we're certainly actively looking for it as much as possible.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Good afternoon. Teachers, unvaccinated nurses, couriers, there are countless groups who are looking for more transparency on the vaccine priorities. Now that you have a steady supply and appear to that you will have one now going forward, why is there still no firm hierarchy in phase 2?
So, we've not, I think we've been pretty clear that people who are at the highest risk for severe disease are certainly our priority groups, and that's why people over the age of 70 are being done first. And we're looking at people who live in congregate settings, adults who identify as Indigenous. All of these groups we know are at higher risk for severe disease, and so we are targeting those groups. And we have, essential workers and healthcare workers, as well as first responders and rotational workers included in that group. And certainly with the advent of the AstraZeneca vaccine now, that does allow us to get to those groups a little bit sooner. So, we will be announcing that when we know about the stability of the AstraZeneca supply.
Okay, yesterday we heard of a number of 70-plus seniors who used access codes from their friends or relatives. And it's conceivable a lot of them had no idea they were skipping line. So, again, I'm asking, why is there a reluctance to literally set out a hierarchical list of who and when is going to be vaccinated?
So I think, the list that we have in our vaccination plan does list who we feel are the most important people to get done first, and then carrying on through the list. However, we do know that people who are at highest risk for severe disease, it is more appropriate for them to receive an mRNA vaccine. And so, we are trying to deliver the AstraZeneca vaccine to the groups that are not in that same severe risk category for severe disease. And, we don't want to be too prescriptive. We need to have some room to be flexible. And so, the list that as we have it allows us for that flexibility.
Okay, thank you.
Our next questions are from Mark Quinn with CBC. Please go ahead.
Thank you. The changes that are announced today, what will they mean to high school students who are still studying from home? Will that change soon now as well?
So our recommendations to schools remain as they are, and so what that means from an operational point of view, I guess I'll have to direct you to either education or the school districts to answer that question.
Thank you. And as a follow-up, what do you say to nurses who haven't been vaccinated, fear they are at risk of being exposed, and don't know when they'll be vaccinated? We're hearing from some people.
Sorry, Mark, it's quite difficult to hear you. I apologize. Do you mind repeating, speaking perhaps a little louder?
Sure, I'll turn on my mic. Is that
There,
better?
Yeah, that's much better. Thank you. Sorry, Mark.
Okay. We've been hearing from some nurses, and we're wondering, what do you say to nurses who haven't been vaccinated, fear they're at risk of exposure, and don't know when they'll be vaccinated?
So certainly we will be getting to healthcare workers very soon, and as soon as we have those plans in place, we will be letting people know, and it will be soon.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. I'm going to follow off of Peter Jackson's questions there. In regards to the phases, we've seen the list within the phases. I think the concern for a lot of people is not knowing, we see this list, but not knowing where you land on that list. You say highest risk first. Why not come out with a clear list of saying it's first responders, it's healthcare workers that haven't been vaccinated yet, then it's teachers, then it's... Why not have this list set so that people aren't always worried that they've been missed?
So I guess I'm not sure what about the list that we put up there is not answering the question. We have the list of people of each of the groups. I mean, we can't differentiate every single essential worker. That would be exhaustive, and I don't know that we would get everybody. I mean, we've had, so we have defined groups as best we can, but you know, and healthcare workers are in there specifically, and we are working through them. So our goal right now is to get those people with the highest risk of severe disease, which is certainly our, you know, our over 70. We know age is the biggest risk factor for severe disease. And then we'll be moving through the rest of the categories that are in the list that we've put up there, knowing that the AstraZeneca vaccine we can use those for some of the groups that are like we have for first responders at this point, and that, you know, as we have more AstraZeneca vaccine, we'll be able to offer it to other groups.
Sorry, maybe I should clarify. In terms of the list that you do have for phase 2, you know, we've seen it that it's essential workers, frontline, teachers. I'm just wondering, so the list there, is that the order you're looking to go through? Because that's, I think, where people are confused. They see a lot of people in the phase 2 category, but not knowing the hierarchy of it. We know that it's highest risk first, but to everybody, they believe they are the highest risk. So just wondering, is the list that we see, is that the order we're going through, where on the top it's 70 plus, and then it's teachers, and it's rotational workers? That's where I think there's a lot of confusion and concern right now.
You're looking for the hierarchy within the phases itself.
Yes,
so
thank you.
The way that they're written there now is the way that we're hoping to move through the groups. However, bearing in mind that as we get more AstraZeneca, the groups that are appropriate to receive AstraZeneca vaccine will receive the AstraZeneca vaccine as we get it as well. So it may be that there's a point that there's 2 parallel streams happening, but that generally speaking, that is the hierarchy that we're moving through.
Thank you. That clarifies it. Thank you.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Hello. Question for the Premier. Mr. Furey, what do you make of the fact Elections NL allowed a handful of voters to vote by phone when everyone else had to vote by mail or in person in advance poll?
You know, as I've said from the beginning, I'm not responsible for running the election. They are. I understand that they're dealing with it in an open and transparent way. I can't speak to why it happened or how they made that decision, and I would suggest, you know, you kind of ask them about it, but it's always troubling when you hear things that are outside the norm, but I understand Elections NL is handling it now in an open and transparent way.
And this morning, the leader of the opposition, Jess Crosby, said that this election is making a laughingstock of Newfoundland and Labrador. Do you agree?
No, Newfoundland and Labrador is not a laughingstock, and anyone who says otherwise is wrong.
Thank you.
Our next questions are from Elizabeth Witten with All Newfoundland Labrador. Please go ahead.
Thank you. Earlier this week, the St. John's Board of Trade sent a letter asking the province to go into alert level 2. And just to clarify, Dr. Fitzgerald, did that play any role into your decision making to kind of what was in line with what they wanted?
No, so the decision was made before, I mean, the discussions happened before that letter came out. And, you know, so we had been considering it. It didn't really factor in at all.
Thank you. And on the government website, it says restaurants can open at 50% capacity in alert level 3, but in alert level 2, it says they can open at reduced capacity. So I just want a little clarification for the restaurant workers out there. Is it still 50% capacity in this alert level?
Yes, it will be 50% capacity for now. That information should be updated to very shortly, actually, if it's not updated already.
All right, then. I checked this morning, so good to know. Thanks.
Okay.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. Global News recently surveyed each of the provinces seeking specific answers to questions surrounding the vaccine rollout and called Newfoundland the Mystery Island because they had trouble getting any solid information from officials here. Why was that?
I don't really know. I don't recall being asked, but yeah, I don't have an answer for you.
Don't recall being asked, but we're here you're here 3 times a week, 4 times, 5 times a week.
Our plan is up on the website, so I don't know why they aren't able to get the information.
Okay, and Dr. Fitzgerald, I've heard that some rotational workers have been vaccinated at their work sites in other provinces, such as BC, for example. How does that impact our ability to keep track of vaccinations when we have people from here getting vaccinated in other parts of the country? Logistically, how does that work?
So we have a process to, get that information. So if somebody comes forward and says that they've been vaccinated, presumably they'll be given some information to indicate that they've been vaccinated. So I would say to people, if you've been vaccinated elsewhere, please hold on to any information that they give you about that so that you have some evidence to, and often they'll write the type of vaccine that you got and that sort of thing. So that's important information to know. But if need be, we can get that information. We just reach out to the public health units in whatever province or territory people were in. That process has been there all along. We have lots of people who transfer, kids who transfer into our province who we need to update their vaccines or we need to carry on with their vaccination schedules. So there is a process that's been in place for a long time of how to share that information.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Hi. The public service, should it be taking a more broad policy stance on working from home, since that's been a constant and a consistent recommendation from the Chief Medical Officer of Health? I guess that's a question for Premier Furey or the Minister.
Of course, most of the public service is working at home right now, and as Dr. Fitzgerald has said, if you can work from home, you should, and that changes obviously with the changing levels and the changing epidemiology. But the building is fairly empty here. I think Dr. Fitzgerald and I would agree that the hallways are empty. Most people are working from home if they can. I know the public service has done an amazing job in adapting to this crisis in particular, and some have come and take their workstation home, their laptops home, their specific chair at home if they have occupational health issues. So I really commend everybody for going that extra mile and stepping up and working from home, which can equally be trying, as we all know.
Okay, thank you. And I just have a question for Dr. Fitzgerald. If Canada's Chief Public Health Officer granted quarantine exemptions to international rotational workers in this province, would they be afforded the same modified quarantine rights as domestic workers?
So we have to, look at that carefully. It depends on where a person comes from, certainly, and exactly what the situation is. Unfortunately, I don't think that is happening very often, that the Chief Public Health Officer is actually granting exemption to quarantine to workers. Certainly there are some essential workers that come into the into the country that are granted those exemptions. So we would have to look at it on a case-by-case basis, I guess. But in general, no, we have our policies in place. They're there for the protection of everyone, and right now it is as it stands.
Thank you.
Our next questions are from Mark Quinn with CBC. Please go ahead.
Yes, just for a bit of clarity on the people who booked using someone else's booking code. I heard from a woman who said that she had done this and didn't realize that it may have consequences for other people. And she wonders if it would be best for her to cancel her booking and wait to be rebooked later, or should she just go ahead and get the vaccine with the booking that she made?
It's probably best for you, Minister.
Certainly, from the point of view of my information from NLCHI, who oversee the software, no one outside the high-risk category of over 70 is actually been included and given an inappropriate appointment. I think the other comment from Eastern Health and NLCHI is that this problem has now been fixed. If this person is in the category of high risk and has an appointment, I would suggest it's probably as important that they get a vaccine in their arm as not.
Thank you. I think that clarifies that for this particular case, but I think other people who are over 70 who've booked may have the same question, so that should clarify things for them. The other question I had is for Dr. Fitzgerald. If all the evidence does suggest that it's, you feel it's safe to move to level 2 on Saturday, people are asking why not do it now?
People ask that every single time, I think. We're still waiting. We wanted to give it the 2 weeks, as we had suggested. That is an incubation period, so that's why we wait the 2 weeks. Hopefully things don't go sideways between now and then. If it does, we may have to reconsider that. But so that's the reason why we're waiting. It's the 2 weeks.
Thank you.
Mark, if I could offer a comment that I heard from businesses of the St. John's Board of Trade, their members actually need some lead time to be able to prepare staffing and ordering and bringing in food, for example, in the situation of restaurants and these kind of things. So they were very keen that they would have some advance notice. Otherwise, they would be at a business disadvantage. I'm going to take a liberty, if you don't mind. I've just had a note passed to me by staff that a modest number of individuals who are receiving appointments by email are finding the email from the regional health authorities in their spam folder, and they're turning up late. So with the help of the media, it would be useful if that piece of information could get out there so that people who may not be as familiar would look in their spam or junk folders before calling, because they feel they haven't got an appointment. So I'm sorry about the liberty, but I thought it was the only opportunity I might get. Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Dr. Fitzgerald, Canada's Chief Science Advisor, Dr. Mona Namer, has advised against extending the time between doses to 4 months for seniors. This is based on recent data and efficacy coming through several studies. What is the province looking to do here? Are we looking to make a change for those seniors to go back to the 28 days, or are we still looking to continue with 4 months?
So at this time, we're taking our guidance from the National Advisory Committee on Immunizations, which has been the trusted committee that we have relied on for many, many, many years, and has guided us through all of this. So we're taking our lead from them. Certainly the evidence that we have seen from within our own country in Quebec and British Columbia is that there is still a robust response from an immune point of view. We do see a reduction in cases and in severe disease and symptomatic disease, even in the elderly. And so the expectation is that immunity does not wane very quick. It won't wane kind of overnight. So certainly the evidence that we have right now is indicating that an extended period is safe. Obviously, if that changes, certainly if we see more evidence that points us in a different direction, then we will pivot and move that way, as we've always said we would do. But right now, we're still taking our guidance from the National Advisory Committee on Immunizations.
Thank you. And there's a lot of concern coming up about AstraZeneca. We've seen it before in terms of several countries halting the use while an investigation is ongoing. Now we're hearing about a recent study in the United States where outdated data might have been used. A lot of people who are already hesitant about being vaccinated, this may have increased and heightened that fear, especially when it comes to AstraZeneca. What is to happen to those who might refuse the AstraZeneca vaccine? Do they get moved to the back of the line, or what happens in this situation?
So first of all, what we know about AstraZeneca right now is that it is safe and it is effective. Certainly there have been some signals, and the whole process of vaccine vigilance, this is what it does. We look for these signals once we get out in the real world and we start using this vaccine, in millions of people, that we look for any of these signals that could, be early warnings for something. Certainly with regard to, blood clots and what they call pulmonary embolism, so these are blood clots in your legs or in other parts of the body, that signal, certainly we're not seeing that in at a higher rate than what we would expect to see in the general population. And so there are, 11 million doses in the UK, and they haven't seen that kind of signal there. The other disorder that they're talking about with these central sinus thrombosis, sinus vein thrombosis, that is certainly being investigated, and it is still exceedingly rare. However, we have to remember that, I'm not sure of the exact number of cases at this point, but, when we talk about millions of doses given and the number of cases are in the single or very small double digits. So this is not a very common thing that's happening at all, and certainly from a risk-benefit point of view, the risks, the benefits of getting the vaccine really far outweigh the risks at this point. So it's important to really remember that. If somebody chooses, for whatever reason, not to get the AstraZeneca vaccine, then they certainly have the opportunity then to wait for the mRNA vaccine with their age group.
Kelly, just to pick up, I think it's important that people understand that there's been no link to causality here whatsoever. So I think that's fair to say, right, Dr. Fitzgerald, that there's no link between AstraZeneca causing any clots. Clots exist in life, and there's no evidence to date that AstraZeneca is linked to a causal relationship when it comes to DVTs or PEs.
Yeah. Thank you.
I will now go back through each reporter to see if you have one final question. Elizabeth Witten with All Newfoundland Labrador. Do you have a final question?
No, I'm good, thanks.
Thanks, Elizabeth. Richard Duggan with VOCM. Do you have a final question?
Yes, I have a question from someone who is wondering about mask wearing in schools versus in daycares. Of course, wearing a mask all day is required for those in grade 4 and up, but in daycares, the school-age children that attend daycares, it's not mandatory in daycare. So just wondering if we could get some direction on what you would recommend those children do.
Certainly, anyone who's in daycare, we would recommend that you wear the mask as much as possible in the daytime, recognizing that the majority of children who are in all-day childcare obviously would be likely too young to be able to comply with wearing a mask all day. Those that come for after-school programs, certainly the recommendation would be that as much as possible that they wear a mask. If they are eating at, those sorts of things and seated at tables, then obviously they wouldn't be wearing their masks. But otherwise, yeah, as much as possible. Indoors.
Thank you.
Peter Jackson with the Telegram. Do you have a final question?
Yes, very quickly, Dr. Fitzgerald, I wanted to follow up on my last question. Is it fair for me to say that the federal quarantine law is not the only consideration in your assessment of international workers here?
So certainly, it's a big consideration. You know, we can't override federal quarantine law, but it's not the only consideration. We do have to look at other things as well, and we know that certainly internationally there's concern, you know, with other variants that are that we're seeing in other areas of the world, and about the importation of that. So there's certainly other considerations, but obviously we can't override a federal quarantine order.
Okay, thank you very much.
Mark Quinn with CBC. Do you have a final question?
Yes, I do. Thank you. As the number of people vaccinated increases in Newfoundland and Labrador, but also in other parts of the world, will that change travel in and out of the province? For example, someone asked me if someone's received 2 doses of the vaccine, will they be able to come to Newfoundland without having to self-isolate for 14 days at some point in the future?
At some point in the future,
I mean,
being
yeah,
a qualifier.
ultimately, that is our goal, for sure. We are still learning about the effects of this vaccine on the transmission of virus, and so that's really important. And as time goes on and as we vaccinate more people, I think we'll get that information. But as of right now, we just haven't got enough people vaccinated that we can really determine that at this point. In certain small groups, perhaps we can, but not in the population as a whole. So for right now, we do have to still maintain those public health measures. But you know, we'll see what the next couple of months holds for us, and what kind of information we get out of that. But we do have to remember the most important thing is that, you know, you're not considered fully vaccinated until you have that second dose. We know that you get a substantial amount of protection with 1 dose, and that's why we want to do as many people as we can with 1 dose. But to get that that little bit of increased protection as well as long-term protection, the second dose is really important. So we have to consider that as much as we all are looking forward to having everybody vaccinated with 1 dose of this vaccine, you're really not fully vaccinated until you've had the second.
Thank you.
Kellyanne Roberts with NTV. Do you have a final question?
Yes, thank you. Dr. Fitzgerald, you noted that there might be 2 parallel lines happening at once in terms of the vaccine rollout plan. Right now we know, based on the federal government's website here, that there's no allocation for more AstraZeneca vaccine to the province right now. If there was to be more coming, who is next in line for that after we go through first responders?
So it's hard, you know, to say that right now, because we don't know exactly the amount that we're getting. We don't have those confirmed supplies, so we don't really want to put that out there until we know. So, and once we do, we'll certainly be quite transparent about who will be able to receive that.
Thanks.
Thank you, everyone. Premier, do you have any final comments for today?
Well, thank you all for joining us today. Because of your hard work, each and every one of you at home, in following the public health guidelines, we're able to get to a bright day today and into the weekend. So it's good news for Newfoundland and Labrador today. We're seeing the fruits of our labor, the fruits of the sacrifice that everybody has made, businesses, individuals, communities, families who have followed the rules and followed Dr. Fitzgerald's guidance. So today is a good day, but we need to keep it that way by following the rules and don't let COVID fatigue or COVID complacency set in. It will be what keeps us at alert level 2, which is where we want to be until everyone is vaccinated. So there were dark days, we got through them, and we will continue to get through this phase of this pandemic together. So everyone stay strong, stay safe, and we'll get through this next phase together as well.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.